Hello, I'm Dr. Donna Gourlay. This is another installment on budget and financing, which will focus on the state of California to understand how our state is financed for public health. You should recall from a previous video that California's public health services are arranged in a decentralized model, meaning that the activities actually occur at the county and sometimes city level, with allocation of funds coming from the state to the counties. The state agency develops policy, disperses funds, collects county data, reports health trends and outcomes to the federal government, in addition to oversight of the county agencies. There are a variety of centers and offices within the state, as you can see from this list. When I worked for the county health department, I routinely interfaced with the Center for Environmental Health. And when I worked as the Director of Environmental Health and Safety for Loma Linda University Health, I routinely interface with the offices of healthcare quality, emergency preparedness, and accreditation for the healthcare institutions on our campus. Now let's look at the department's budget and funding sources for CDPH. The department is funded through three primary sources. First, general fund monies, which are state tax dollars and comprise only 4% of the department's funding. Previous funding models included larger portions of general fund monies, but this has changed over time. Federal funds make up 57% of the total budget. This would be mandatory federal appropriations. And finally, special funds and reimbursements make up 39% of CDPH's budget. This category would include funds from grants, discretionary federal funds, and other monies like bonds designated for specific purposes based on the proposition or measure that authorized the bond. Looking at this chart, there has been a reduction in both federal and special funds, which means a reduction in budgetary and ultimately services to the public. The programs listed above are administered by the state and include emergency preparedness and response, environmental health, licensing and certification, and administration. In reviewing this chart, you can see that the emergency preparedness program was cut by almost half due to decreased funding, and administration increased by 21%. Licensing and certification permits and inspects a variety of health facilities from daycare centers to hospitals to ensure the safety of those who are receiving care or other services. They also investigate complaints from the public about the quality of care or services received from these organizations. For these programs, the breakdown of funding comes from the following three sources. 1, special funds and reimbursements, which is 55%. 2, federal funds, which is 34%. And general funds, which is only 11%. In conclusion, California is a big state. It has a lot of people, over 39 million people. It has a lot of different responsibilities under the Department of Public Health, from licensing and inspecting facilities, healthcare facilities, to doing environmental health, to investigating and inspecting shellfish areas. There's a whole host of things that are included under CDPH's umbrella. Most of the funding from CDPH for CDPH comes from the federal government. And finally, funding shifts really depend on trends and things that happened during the previous year. So the funding mechanisms are always changing for public health. Thanks for watching and have a great day.